Okay. Hi, everyone, and welcome to our third webinar in our series on developing an effective language access plan. Jackie and Kayla are here to moderate this webinar. We wanted to take a second to introduce the wonderful Jose Juan and Lumari, who are going to be facilitating this webinar. So Jose Juan is a project coordinator at the National Latina Network. He's been involved in the movement against gender violence since 1999 and has facilitated workshops on crisis intervention, systems advocacy for victims of family of sexual violence, and LGBTQ victims of interpersonal violence. Lumari is a community psychologist and a project manager for the National Latina Network for Healthy Families and Communities, which is a project of Casa de Esperanza. Lumari's areas of expertise and interest include Latina youth development and advocacy, community leadership and engagement, language access, and organizational development. So at this time, we're going to turn it over to Jose Juan and Lumari.
Hi, everyone. Can y'all hear me?
Yeah, we can.
Awesome. So welcome, everyone. My name is Jose Juan Lara Jr., and as it was mentioned, I'm a project coordinator with Casa Esperanza. I'm joined by my colleague, Lumari Orozco. Lumari?
Yeah, hi, good afternoon, everyone. Sorry, I guess I must be muted. Am I muted? Can you hear me?
Yeah, we can hear you.
Okay, great. Sorry about that. I was speaking and then you jumped in and I wasn't sure if I was muted or not. So I wanted to thank everyone for joining us today. It's a pleasure to have you all with us. For those of you who, hopefully most of you on the line had an opportunity to join us for the first two webinars in the series on developing an effective language access plan. If you haven't had a chance to, or if you weren't able to join us, certainly do encourage you to check out those webinars. They have been recorded and can be made available to you. So today the purpose of the call basically is to do a quick recap, a very general recap of what it means to provide effective, to develop an effective language access plan, as well as what it means to provide meaningful language access to victim survivors with limited English proficiency. And then we also have a couple of questions that PCAR had shared with us that they'd like for us to address, so we'll do those. And then we'll go ahead and open it up to all of you for any of the questions that you might have. I see that there is a question that was asked by Rose, so we'll make sure that we address that question as well. But as we go along, we certainly encourage you to, chime in on the chat, let us know any questions that you have, certainly any challenges that you might be facing as you're developing your language access plan or enhancing one. If you haven't started yet, certainly, let us know whatever it is that you want to know more about. We do have a good hour and a half. We're more than able to stay on the line this whole time. We just want to make sure that we're able to provide with you all with as much information as possible to make sure that we get you started on the right foot as you start to develop, your own language access plan or possibly enhancing one that you currently have. So I'll go ahead and turn it over to Jose Juan. Thank you.
Thanks, Lumari. And just very briefly, in case folks are not aware of Casa Esperanza, we've been around since 1982. Our mission is to focus on Latina leadership, entrepreneurship. Then we also understand that the end of gender-based violence is through community and emphasizing a community engagement model in the work that we do, whether it's at the local level or at the national level. And then throughout the years, Casa Esperanza began to be acknowledged around the work that we do around community engagement. And so we got an OVW grant, and we became, which extended our work around our national project, which is the National Latina Network, a project of Casa Esperanza, and our work at ending violence and promoting health and well-being of Latino communities around the country. And again, as part of our national work, we have three main pillars that we focus on: public policy, research, and training and technical assistance, this is one of those aspects of training and technical assistance. And certainly language access is just one of our many areas of work at Casa Esperanza National Latino Network, which we encourage you to visit our website and also become part of our listserv, which you'll receive our weekly newsletter that it has information on upcoming webinars that we may be hosting, funding opportunities, and so on. Right. So with that said, we thought we wanted to do a recap for folks who may have participated in either or both of the webinars, just to get a sense of what was captured based on the information we shared. So at this time, as part of our interaction piece, we'd like folks to please put their response in the chat box, like what is the definition of limited English proficiency? For those of you who attended the last webinar, that was defined. So for those of you who had knowledge of that, if you can at least attempt to define what limited English proficiency, a person with limited English proficiency is. We'll give you a couple of minutes. And again, there's no right or wrong answer. Just take an opportunity to answer the question. I see folks are typing. Okay. Okay, so the answers are lack of understanding of nuances of language, a person who has some understanding of a language but may not be able to read or write the language, can speak only a limited amount of English. Almost, okay. So those are in the vicinity of the answer. But basically, it's individuals with limited English proficiency are individuals who do not speak English as their primary language and have a limited ability to read, write, speak, or understand English. And again, we just wanted to recap that definition because, again, that's the entire focus of this work that we do around language access. So just keep that in mind. All right, thank you. All right, another question for folks to answer. Again, same process, put your answers in the chat box. How would you summarize the importance of providing language access? If folks could just, again, write their answers in the chat box. And again, there's no right or wrong answer. Just want to assess some knowledge here. Extremely important. Yes. Folks are typing. Very important to be able to provide services. Provides equity, legal and ethical standards, basic access. Okay. In the responses, any individual with limited English proficiency is not denied the opportunity to access and obtain the services and supports necessary for their safety and well-being as a result of language barriers. Again, this is very important, particularly because of the work that we do, especially for those of us who work directly with victims of crime, in this case domestic violence or sexual assault. The services that we provide are life-saving services. So just making sure that we understand and the importance of the work that we do. All right, last question on the recap. Define meaningful access for limited English proficient individuals. Again, so if you can just provide your answer in the chat box, can y'all please define what is meaningful access for limited English proficient individuals? People are typing. All right, so access that provides results as expected for any person who's proficient in English, being able to receive access to all services equally, opportunity to communicate in one's language of choice, going beyond the floor, basic access to the ceiling. Awesome. Provide information so victim can make informed choices. Yes, it's always important. So overall, generally speaking, because it's the right thing to do, again, for a lot of us who do this work, we come into the helping profession and particularly working with survivors of sexual assault because we want to help increase and enhance the safety of survivors. So it's also because it's the right thing to do. Language access improves services and enhances outcomes, as some of you kind of referred to that. And it's a legal requirement. And we kind of focus on these three areas because sometimes it's not enough for folks wanting to do the right thing. A lot of times good intentions are great, but we also need to know why this is important. Again, it's because we provide life-saving services. That's why it's important. And because it improves. And if we are able to provide equitable language access to everyone, it also improves the way we do our services, the way we provide increases the outcomes for safety and healthy and well-being for survivors of sexual assault or sexual violence. And then if that doesn't work, then it's because it's a legal requirement. If you receive any type of federal funding, and most of us do in our organizations, it is required to have language access as part of your services. So we kind of do this three-point approach every time we are talking about meaningful access as well. So thank you for sharing your responses. Lumadi?
Okay, so we'll go ahead and get started. And we'll just start with the questions that were already submitted, and these are the ones that are listed here on this PowerPoint slide. And so the first one I'll start with is, what is the best place to get started? Wow. Okay, that's a great question. So I think a best practice would be to really build a foundational understanding of why you're taking this on. Why are you doing this work? As Jose Juan mentioned, we work with a three-pronged approach, looking at first the legal requirements of why we're doing this work, right? So as he mentioned, given the fact that a lot of us receive federal funding, it is a federal requirement established both by Title IX of the Civil Rights Act of 1964, as well as the Executive Order 13166, which was an order that was issued, I want to say, by Bill Clinton, maybe 10, 11 years ago. And basically what that executive order said was that any federal agency and or federal entity or any entity receiving federal funding or financial assistance from the federal government needs to provide meaningful language access to their services. And it's basically really about ensuring parity and ensuring equitable access to services for survivors. And so when we're talking about what's the best place to get started, it would be at really looking at, building your own understanding of why this is important to your organization, not just in terms of the federal requirements, but also in terms of the moral and ethical piece of the work that we all do. As Jose Juan mentioned, we are in the work of saving lives and ensuring the health and well-being of our communities. So I think it's really critical to be able to not only build that foundational understanding of why you're doing it, but also to familiarize yourself both with the Civil Rights Act of Title IX and the Executive Order, because those are the two things that are really going to get people's attention. I think doing this work, we oftentimes operate from a place of the heart, right? Like our former president, Casa Esperanza, Lupe Serrano, always used to tell me when I came to this work about 13, 14 years ago, is that, this is work of the heart. and you're moved by the work. And so that's what propels us into doing this work, not necessarily any federal requirements or anything like that. It's basically the fact that it's the right thing to do, the moral and ethical thing to do. But not everyone speaks that heart language, right? So although it is the right moral and ethical thing to do, you know, we also have these federal requirements that kind of propel us into doing this work, right? And oftentimes that's the language that a lot of our leadership might speak, right? That's the thing that's going to propel them into understanding that here is why we need to provide meaningful language access, right? We have these two federal requirements before us, and this is how, if we don't provide meaningful language access, how it can impact us as an organization. And I think what people fail to realize oftentimes is that, you know, if we don't abide by the federal requirements, we run the risk of having complaints filed against us as organizations. There is a complaint process that the Department of Justice has, where if a survivor or victim is denied access to services because of a language barrier or any other reason, they have a grievance process that they can follow, where they can submit a complaint online. The DOJ will investigate those complaints and will, you know, carry out sanctions, and would expect for organizations to act appropriately and by the requirements that they've set forth. We've seen a lot of this happen in North Carolina. We've been doing language access work in North Carolina for, I'm going to say, the past 6 years or so, and we've run into organizations who have repeatedly denied access to services for survivors with limited English proficiency. And so what's happened in those cases is that, you know, complaints have been filed, the federal government has stepped in, DOJ comes to the state of North Carolina and has actually put sanctions on programs in order to make them comply with the federal requirements. And oftentimes, just having that tidbit of information in your arsenal of tools or your toolkit really does help build that foundation and understanding for others in your organization by making it really clear that this is, you know, the main reason why we need to do this, in addition to the fact that it's the right thing to do. So I would say go ahead and really start building that foundation of understanding for yourself so that you can communicate this information in a way where folks in your organization are really going to pay attention and take heed to it. I also would say find out if your organization has an existing language access plan. For us at CASA, I developed our language access plan with a team about 6 years ago or so. And before then, we had never had a language access plan. But we did have language access practices in place. So, you know, we have bilingual staff. We have access to an interpretation line. We had already had used interpreter service, in-person interpreter services in the past. And so for us, it was really about looking at how we formalize those practices into a policy that's written and easily accessible to all of our staff. And so I would say also think about, you know, look to see if you have an existing language access plan. If you do, then what you'll want to do is take it out, kind of review it, familiarize yourself with the language access plan. If you have an opportunity, meet up with the individuals who actually drafted that original language access plan if they're still around. Get some feedback, get some input, have some conversations around, you know, what were the challenges that they faced in developing that language access plan? What was it like to get staff and leadership buy-in into that process? You know, what kind of training was provided? Again, just to familiarize yourself with all of that. If you find that your organization does not have a language access plan in place, what I would encourage you to do is certainly to look at or visit our language access plan, or languageaccessplans.org, or you can visit our National Latino website where we have links to both our language access toolkit and our language access in the course toolkit. And our Language Access Toolkit is a toolkit that I mentioned in the previous webinar. Really is about, it's a guide that takes you both through developing a language access plan from scratch and also enhancing an existing language access plan. You have the option to pick what you want to work on, and it'll take you step by step by step by step. It's something that's self-directed. You take it at your own pace. You go at your own pace. And the information is very easy to understand. It has multiple links, and it'll take you directly to those links to read more about what information is needed there. We also have a template, a language access template that you can print out, kind of follow along. And so I would say that that would be the best place to start. I think prioritizing really, starting to have conversations with your leadership and management about providing language access, about the fact that you're going to take on this process to document and formalize what you're currently doing, right? Because what we know is that you're all at one level or another are already providing some sort of meaningful language access to individuals in your community. This is just a process to formalize that policy so that it's in writing, so that you have it to refer to, so that you can use it as a training tool to build the capacity of your staff to provide meaningful language access, so that you can train staff on how to access the interpretation line, for example, or how to access an in-person interpreter should it be needed. So kind of really thinking through those things and kind of prioritizing, really looking at, what you have already in place, and having conversations with those folks in leadership who are going to support this process and who are also going to be able to inform the development of that process as well. Let's see. So we talked a little bit about prioritizing first steps. How do you get the organization and individual buy-in? When we started developing our language access plan, what we did first off was have a conversation with our leadership staff. Who are those in charge of making these types of decisions? We already knew that language access was critical. We also knew that we needed to get on it and develop a policy that was going to allow us to formalize the current practices that we all had. We're an organization with different components. We have both a local shelter program, a community advocacy program. We have a community engagement program. Also, we have our national work. So it was really looking at those components of the work and identifying what we were already doing in those areas around language access. And then having conversations with those individuals responsible for those work areas to let them know, hey, we're in this process of working with this language access plan, developing this language access plan. We've had some conversations with your staff to kind of identify what they're currently doing in terms of language access practices. And then just kind of sharing this information with leadership. Again, we were very key or very focused on sharing the fact that there are these federal requirements, right? I think for us as a culturally specific organization, we ran into issues or situations where some of our staff felt, well, we're already providing language access, so there's no need for us to do this, right? And yes and no, right? So for us really is that, we are a Latino organization based in St. Paul primarily to provide services to Latino communities in the St. Paul, Minneapolis area. But we're also known that we are also a first come, first served shelter program, which means that when we have an open bed, that open bed goes to whomever needs that bed. And so we ran into some situations where we had survivors come to shelter who were Limited-English-Proficient individuals from other communities who did not speak Spanish. So helping, our advocacy staff and their management team to see that we're providing services to other survivors who are also limited English proficient and who do not speak Spanish, it's critical for us to be able to document this process and to be able to have these protocols in place. And I think, for us, it was very easy. I think as a culturally specific community-based organization, to get everyone on board as far as the documentation and the development of this language access plan. I think one of the challenges that we did run into, though, was in figuring out how this gets funded, right? So when the federal government gives us federal funding, they make the assumption that we're already utilizing some of those monies they provide us with to provide language access services. And what we find oftentimes is organizations, who receive the funding oftentimes don't have a budget item line in their budgets specifically for language access. And that would look anything like setting aside monies for translation of materials, setting aside monies to pay for any cost incurred by the utilization of an interpretation line, any cost incurred with having an in-person interpreter come to provide services. So I think some of the pushback that we received and challenges that we had in obtaining organization and individual buy-in came from those folks who felt that we just didn't have sufficient funds to be able to provide language access, which is something that many of you are going to be running into when you start having these conversations, because oftentimes it does boil down to how much funding is available or where are we going to get the funding from. So just to share with you that, the expectation is that since you receive the federal funding, you already have funding to do language access work. It's a matter of figuring out how you allocate those funds. And so when we talk about meaningful language access, like we talked about in the previous webinar, it really is looking at, what is feasible for you as an organization, given the access, your current financial situation, what that looks like, what that might dictate what types of language access services you might be able to provide. For example, if you're a smaller organization with a small budget, you might be able to allocate, $500 a year to the translation of materials, to the use and interpretation line, and to the use of in-person interpreters. And if that's what you as an organization can do, that's providing meaningful language access for your organization. And it's a matter, again, figuring out how you allocate those funds, where you might have to pull a little from, this item line and that item line to kind of get you some money in a little pocket that you might be able to reach into as you need to in providing language access services. For us, we had to do that. We had to move some monies around, and we set aside a certain dollar amount. And I can tell you that over the past 6 years, and we didn't set aside, a large amount of money because, we also have budget constraints. But I have to say that we've been very mindful in how that money gets utilized. And also we've run into situations where there have been, 6 months has gone by and none of those monies have been utilized, right? So we kind of redo and revisit that budget like on a yearly basis when we do all of our budgeting for the next fiscal year. But it's really important to help those folks who make those financial decisions understand the importance of this. Right, the importance of, we have these 2 legal requirements, also looking at the fact that, if we don't comply, we may run the risk of losing our own federal funding. Should a complaint be filed? Should an investigation take place? Should DOJ come in and investigate or sanction us in some way that's going to, that kind of forces us into compliance? And if you can totally avoid that, the best way to do that is by being proactive and really figuring out how you make this happen with the resources that you have available to you. And I guarantee you that once you start working on developing your language access plan, once you've kind of put a team together to work with you on the plan, you'll want to, of course, look at, folks from different parts of the organization, folks who would be able to kind of gauge or gain organizational buy-in from their area of work. Let those folks be the ones who really go back to their work areas and are able to explain that this is the why it's important for us to do this work, and this is why we're going to be doing it. So I hope that helps to answer that question. What is the best practice for hiring bilingual staff? Whew. Okay, so I would say, first of all,
Yeah, so I think, and I don't know what you're going to share, Lamar, but I think for me, to answer this question is always kind of challenging, but I think the first thing is defining who a bilingual person is and why you're wanting to hire a bilingual staff person. And also understanding that because you're hiring a bilingual staff doesn't mean that they're translating everything in your organization. And even at Casa Esperanza, we're also very aware of that we have bilingual and bicultural staff. Some of us may be both. Some of us may be bicultural but not bilingual, or even sometimes limited ability around being biliterate, which is another term I just recently learned about. So having to consider you as an organization, how you define a bilingual person and what is going to be their function. And for me, it's being very clear that just because you hire a bilingual person doesn't mean that they're to translate everything in the organization. That requires a whole different set of skill sets. That is a higher standard of practice. And so for me, that's where it starts. Actually, it's like, why do you want to hire a bilingual staff person? And the answer is because you're providing life-saving services. So to me, that's always a very interesting question. And then I guess then it just depends on the level of service you're providing in the organization. But regardless of that, you know, when you have a language access plan in front of you, it doesn't matter who comes to the organization, who's answering the hotline at that time. You may have staff people that may not be bilingual or bicultural, but they have a plan in place they can contact, and they ask certain questions like, is a family that's coming in, are they bilingual, in what language, or are they limited English proficiency, and what is the primary language? So I think for me, really defining what is bilingual to that organization.
Definitely, and those are great points, also, Juan. Thank you for making those. And I would just add to those is, you know, what you want to look at, too, is you want to make sure that your job announcements are inclusive, that they're very clear in what you're looking for, that you're very clear in, like Jose Juan says, identifying what a bicultural employee or a bilingual employee means to you as an organization, kind of really looking at that. Ensuring that that if you are putting these job postings together or these announcements, that you're also thinking about how will, you know, is there going to be a salary differential for an employee who might have these bilingual skill sets? And if so, you know, what does that look like, and what will you be compensating for? Because oftentimes what we do see is when bilingual staff members get hired in an organization, they might be hired, for example, to be the Latina advocate for the Latino program that an organization is starting or has already in place to work with a specific community. And then what we'll see happen is, like Jose Juan mentioned, you know, there's a document that needs to be translated, and so the expectation is that this individual will translate that material. Or if there's interpretation needed, that individual is going to be responsible for interpreting. Or if there's an event in a certain place in a community and it's not part of their job description, then that person will be the one responsible for, like, attending that event or taking care of that area of the work. So it'll be really important as you're thinking about this, you know, really being thoughtful about how you develop your job descriptions, so that when individuals who are bilingual and bicultural feel included, feel like you're talking to them, in that job description. And really being mindful, again, that if you are going to require an individual to have this extra skill set, then how will you be compensated for that extra skill set? Then also thinking about putting in a mechanism in place to test for oral and written proficiency. You know, at Casa de Esperanza, many of us are bilingual and bicultural, and we're bilingual at different levels of proficiency. For example, I'm Puerto Rican. I was born in Puerto Rico, and I lived in Puerto Rico until I was 5 and then moved to the States. And so I grew up in the States. And so I never really had any formal education in Spanish. All of my education was what I learned at home. And a lot of it was just oral Spanish, not so much written. I've had to learn the written Spanish language. And so I'm not as proficient in Spanish as some of my other colleagues who, for example, grew up, you know, speaking Spanish and who grew up being formally educated in the Spanish language. And so really thinking about, you know, just because a person says they're bilingual doesn't necessarily mean they're proficient, right? So you want to think about what mechanisms can you put in place to test both oral and written proficiency in the language that you're hiring for. And that might include something like having a staff interview or having them interview with a staff member who speaks that language, who can give you a better feel for whether or not that person understands, you know, the concepts that you need them to understand, whether they have the vocabulary that they need to have to be able to communicate effectively. Also looking at, you know, is there an opportunity for you to have them do an on-site translation of a document? I remember when I first came to CASA, as part of my interview, not only did it include interviewing with several staff members in Spanish, but it also included translating an entire document. And they literally, I was placed at a computer and I was given a piece of paper and I was told, translate it. You cannot use spell check. You cannot use anything else. Just, you know, do it to the best of your ability. And then also will give you some understanding of a person's level of proficiency when it comes to any specific language, because you want to make sure that if you're hiring someone for a specific language, that if you're going to be compensating them from that extra skill set, that they also are proficient in the language that you need them to be proficient in. And then I would also say really taking a look at your hiring practices, making it clear in your practices what their role is. And I know that we've run into situations where employers, you know, and we've all done this, and I think we all continue to do this, that we all put in our job descriptions other job duties as assigned, right? And so we run into situations where employers will say, well, you being a bilingual employee means that anything that comes up as an additional job duty as assigned, it's your responsibility to undertake and to perform, right? So that's the way that a lot of employers are able to kind of get away with having bilingual staff do additional tasks outside of the scope of the work that they were hired for. So it's really important to make it clear in your policies that bilingual staff are only to be utilized for their specific job tasks or scope of their work as defined by their job description, or if they're going to be included in doing any additional job descriptions or an additional task, just be sure to include that in the job description. So if you know that there might be a possibility that you might call on that individual to interpret in the office for survivors, or to interpret in community. Let's say a survivor is needing to seek some sort of social services or housing or something like that, or has to visit another social service agency, then kind of ensuring that that person has access to that, but also that that individual who's doing the job, that's kind of already outlined in their description, so that when they're applying for the position, they have as comprehensive a picture of what their position could potentially entail, so that they can make an informed decision. So being able to include those in the job description if possible, and then again, figuring out how do you compensate for that extra set of skills that you're asking that individual to bring with them to be able to perform these additional tasks. And so what are ways, let's see, what are ways bilingual advocates can explain and say no to being asked to do things outside of their job responsibilities? You know, I think as advocates, we're all about being able to just do the work because it's who we are, right? So when we're asked to do things, being the individuals that we are and being in the health and professions that we are, we're more likely just to say yes, we'll do that, we'll take care of it, because we want to ensure that survivors have access to services and are able to and that we're able to provide effective advocacy. And I think it's tough. I think it's tough for advocates just to be able to say no to doing things within, let's say, within, you know, your organization. And I would just refer back to, again, making it very clear in your job description, making it very clear in the interview process, and also being very mindful, right, of when these situations come up, right? I think oftentimes we'll see where, you know, once an organization is developing their language access plan and they identify what documents need to be translated, for example, and they'll say, well, you know, so-and-so speaks Spanish, so they can go ahead and translate these documents. Again, you know, translation is a very, just like interpretation, requires a very specific skill set. Not anyone can just translate a document. Not anyone can serve as an interpreter. So just being very mindful of those things, right? You might have, for example, if I were your staff member and you were to ask me to translate the slide here before you, the vocabulary, the terminology that I might use might most likely be very different or fairly different enough from something that Jose Juan, for example, might translate, right? Or terminology and vocabulary that he might use to translate the same exact PowerPoint. So you'll end up with two different versions, right? Because again, we have two different experiences with the language. We come from two different parts of the country. And so it's very important then to even think about, when you're thinking about what you're going to ask advocates to do, to be very mindful of, you know, does this represent, you know, the messaging that we want to put out as an organization? For example, for many, many years here at CASA, we did our own in-house translating, and it was staff who translated their own PowerPoints and translated their own documents. And about 4 or 5 years ago, we actually hired a bilingual content developer. And so this individual, her sole responsibility is to translate our materials for us. So any PowerPoints that need to be translated into Spanish, she translates those for us, any handouts, any larger documents, simply because it is what she does for a living, so she's very good at it. She's got that skill set. And she also has a very specific vocabulary and set of terminology that she utilizes to communicate the intent of what we're trying to communicate as an organization. And so that's very important as well, thinking about, you know, if you're going to start pulling staff into doing your translations, that you might not get exactly what you think you're getting. So it would be very important, again, to just think through and just be very clear and mindful of what those rules look like. Again, and I would just say that, you know, oftentimes I think when advocates are put in these positions of being asked to do additional work outside of their scope of work or their job duties, it's difficult for them to be able to say no for a myriad of reasons, right? No one wants to be seen as being subordinate. No one wants to be seen as not being a team player. No one wants to be seen as someone who is not complying with what's being asked, right? So it's important for you as an organization to be able to have conversations with your bilingual advocates, just very honest, very genuine conversations around what the expectations are from you as an employer. And also, engaging them in a conversation so that you hear back from them directly as to, what they feel comfortable doing in terms of the additional skill set that they have in speaking a different language. That's a very critical piece to ensure that you're both on the same page, and to ensure also that you're not overburdening your bilingual staff with work that will take away from the actual job that you hire them to do, which is to be an effective advocate for serving the communities that you have them serving. So oftentimes we find that interpretation, translation of materials, and a myriad of other things actually take away from the work that advocates are able to do. It might make them a little less effective in doing the advocacy work that you've actually hired them to do. And I would say just one more thing to that. I think, when it's organizational based is a different approach when working with advocates or bilingual advocates, where you have these opportunities to have these conversations in terms of what they might be able to provide and how they might be able to support the organization with their language skills. But I would say that when it pertains to having advocates serve as interpreters or translators for court proceedings or for meetings with the prosecutor's office or meetings with law enforcement or communications with law enforcement, all of that, I would certainly encourage you as an employer to really invest the time in building the capacity of your advocates to be able to hold systems accountable for providing their own language access services. Oftentimes what we find is that advocates find themselves in positions where they feel that they have to either be the interpreter in a court proceeding or with law enforcement when they're taking a report, or feel that they don't have any recourse, that they don't have any action or any opportunities to do something different. We actually have developed a language access in the courts toolkit. That's a toolkit that helps advocates just be more effective in advocating for language access for survivors with the courts, right? Because what we do know, just like us as community-based organizations who receive federal funding, we also know that prosecutors' offices receive federal funding, courts receive federal funding, law enforcement receives federal funding. So those entities each have their own responsibilities to provide language access. It's a matter of equipping our advocates and building their capacity to be able to advocate effectively to ensure that we're able to hold those systems accountable. Right, so it's, in the toolkit, I think they include a copy of the executive order and a document that references the Civil Rights Act. That is something that advocates can take with them and say, per this executive order issued on this date by Bill Clinton, it says that you, as someone who receives federal funding, must provide interpretation for this individual. And oftentimes, courts might either have a court's interpreter's office in the larger jurisdictions. In smaller jurisdictions, they just might have access to an interpretation line. I've seen where judges have used the interpretation line, in the courts. But there are avenues for advocates to be able to not find themselves in those situations, but it's our responsibility to be able to build their capacity to be able to effectively hold systems accountable for providing their own language access services. And let's see, did I get all of those? I found myself jumping around.
Nope, you did.
I got them? Okay.
Yep.
Perfect. And okay, we can go on to the next slide. There's a next slide. Okay, right? Okay. Are there any questions to now? Does anybody have any questions about anything that I've started?
This is Kayla and Jackie. There are a few questions. There was some that came in over email between the last time we checked in and now, and then there was one that came up in the chat box too. So the first question is, do you have to have a notice, like in your brochures, that interpretation is available when you meet with family members, and is this a requirement?
Yes. So actually, when we talked in last week's webinar, there was a portion towards the end of the conversation around outreach to community, right? So one of the responsibilities that we have as organizations who receive federal funding is that we need to figure out how to communicate with communities that we serve to let them know that we do provide language access services. So yes, so if on your website you have an opportunity to put in a message that you provide, interpretation, if you're able to put a sign in your office saying that you provide free interpretation. If, for example, when you're talking about meaningful language access, I wouldn't necessarily encourage you to revamp your brochure if you already have one in another language, right? Just to include the notice that says that an interpreter is available for you, right? But if you can print out a little piece of paper and stick it in your brochure, or if you could just have announcements around your office, but also make sure that it's part of your intake process, right? Because the thing you're going to run into is that you're going to be able to decipher within 30 seconds of meeting an individual whether or not that individual is going to need language access services. Right, so yeah, it's important for you to be able to notify folks that you provide that service. And it's also, you'll want to be also very mindful on how you communicate that, right? If you say, for example, we can provide you with an interpreter. Me as a limited English proficient individual might take that based on previous experiences that I've had with other service providers or lawyers or whomever, that the expectation will be that Lumari will pay for the interpreter. So if you were to offer me an interpreter in that way, I will most likely say, no, thank you, I don't need one. Because I'm making the assumption that although you can provide this interpreter, I'm going to be the one responsible for payment for that interpreter. So you'll have to think about how you communicate, what your messaging is. And typically, if you're able to say, we will provide free interpretation services for you. So you'll have to include that free so that folks understand that it will not be their financial responsibility to have an interpreter, because oftentimes individuals with limited English proficiency will refuse interpretation services because they assume that they're going to be fiscally responsible for those interpreters. But however you can provide that notice, that would be great, whether it's, again, messaging by posters in your office or in your advocate's office, ensuring that when, someone calls on the phone and your staff knows that they're limited English proficiency or could just tell, being able to communicate that information that we will provide free language access services, either on-phone interpreter, or an in-person interpreter. It all depends on the situation. But yeah, you want to make sure that you communicate with that however it's feasible for you.
Great, thank you. We had another question that was submitted via email. And it says, I know PCAR is working on language access. Will this be available to all centers as well when something is in place? If not, when something is in place, could centers sign up for discounted rates? And so we kind of figured that this is something that PCAR would have to answer. So it sounds like, but we wanted to take an opportunity to do that. And then if you all have anything to add, I think that would be great. But yeah, we're really trying to work collaboratively, PCAR, with Casa de Esperanza to build our language access plan. And we are hoping to disseminate it with centers so that some of that can be replicable to the work that you do, so you don't have as much initial startup work. But we also, I wanted to say that PCAR recently hired Demaria Rodriguez as our language access coordinator, and so she comes to PCAR from working at the National Sexual Violence Resource Center and SafeBirth, and so she's going to really be trying to figure out a great option for our centers in terms of if we're going to keep using language line or some other kinds of services for telephone interpretation. So we are working on that, but Dee just started this this week. So if there are any requests specifically around that, we can get you in touch with Dee, but she'll kind of be the point person moving forward for centers. But we also wanted to just put a plug in that Casa de Esperanza also is a technical assistance provider like PCAR and can similarly provide technical assistance. So is there anything that you wanted to add to that, JJ or Lumari?
I don't have anything. You covered it perfectly.
Okay.
Great job.
Yep, same here.
And then it looks like there is one other question that was in the chat box, so I'll just read it. Can you say more about how bilingual advocates can set boundaries about providing interpretation and translation services within their orgs when it's not part of their job description? It looks like Karen is typing. There's a follow-up.
Yes. So let me start with that as Karen types away there. How can advocates set boundaries about providing interpretation and translation services? I think, it would be helpful if the organization sets a protocol or sets the understanding of what advocates will be allowed to interpret or translate or how, right? Because I think, when we're looking at, I'm thinking about our staff. And I'm thinking about one staff in particular who used to be our finance accountant, and she, she would feel comfortable interpreting just a general interaction, right? Because she was the accountant, so she would be able to greet a person, make them feel comfortable, explain a little bit about our services, till she was able to grab another staff member. But should someone, for example, come in crisis to the office needing advocacy services right away, she would not feel comfortable doing that. So I think it would be best for the organization to set some guidelines, and you can do that as part of your language access plan. So when you're developing your language access plan, there's going to be a section most likely on bilingual advocates. And within that section, you as an organization can set the guidelines of how you expect for bilingual advocates to interact in situations where interpretation and translation services are needed. So, for example, you can indicate in that section that your advocates, your bilingual advocates, will actually be able to interpret in situations for information gathering purposes, for, getting a quick and clear picture of the situation that's occurring or what has recently transpired. Maybe more in that information gathering phase versus in situations where you might need a more involved conversation. And that would also depend on, of course, the bilingual advocate's level of comfort, right? And also, you know, so I'd say would be that. It would be the organization thinking through some guidelines, and I would offer or encourage you to think those through in partnership with your bilingual advocates. If you already have bilingual advocates, make sure you include one or two in this language development process. We did that. We included a couple of our family advocates in the process, so that they also help to inform the development of that language access plan. And I think it's critical to have that representation and also to have those voices heard, right? Because advocates will tell you what they feel comfortable doing and not comfortable doing. So certainly, you know, take a stab at developing some guidelines yourself, some things that the team has thought through. And then also you can have some conversations with your bilingual advocates and saying, hey, you know, we've drafted this piece of the language access plan. Here's what we're considering in terms of what interpretation and translation services would look like for our advocates. You know, what do you all think? Are you all okay with this? You know, is there something that we need to add? You know, is there things that we need to take away? And kind of work it that way in partnership, because not only then are the guidelines that you're developing reflective of the realities and the needs of your bilingual advocates, but in that process of inclusion, it also does start to create that buy-in that you're going to be needing for the implementation and the carrying out of this language access work. So I would certainly think about doing that and kind of having you all define, but having them inform the development of those guidelines as well.
Thanks. So we have another question, and that is, how can folks think about connecting multiple arenas of language access? For example, folks whom English is not their first language, who are using Braille or ASL or other languages within communities of disability.
Oh, wow, Karen, you've got all the questions. That's an awesome question. Well, that's a good one. JJ, do you have any thoughts on that one?
I think I think the level of expectation of advocacy to me is the same. You should be able to provide language access, whether the person is from the deaf community or someone with limited English proficiency. The process may be nuanced a little bit based on the communication that maybe need to address, but the process should be adapted to the situation. So again, when we talk about language access planning, although we're focusing primarily around folks that are not part of the deaf community and it's about limited English proficiency and speaking the language, it's also about addressing these multiple abilities of communication that exist in our communities. So I think as long as you have a plan, just like you would have a plan for someone with limited English proficiency who speaks, you should have someone who may require ASL. And not just limited to American Sign Language, but also making collaborations and connecting with folks who do multilingual forms of sign language interpretation or yes. You know, because that's important, because there's this assumption that we're just talking about folks who are just talking around folks around English, but it's also around languages of lesser diffusion, not just in folks who have the ability to speak in that level of communication, but also that require some form of sign language interpretation. I think to me, the process is the same. The level of practice and expectation should always be the same. It just should be nuanced depending on the situation. So if you had someone that, for example, if you have someone calling, referring a survivor for services, and the person answering the phone, regardless whether it's the receptionist or it's the advocate or whatever, they have a plan. They could pull out the plan and they ask these questions. Does this person, do they speak a different language, and so on? What is it? Then you already have a list of folks that you need. So you may have a list of folks who will interpret in different languages and also who interpret around sign language. So that way it's not you're caught off guard. and it's just a matter of practice and purpose to me. So I think the level of practice expectation is the same. You just nuance it based on the expectation or the ability of communication based on the person that's coming to your organization. And again, once you have that process and you have that list of interpreters around spoken languages, and then also interpreters around sign language, and not only just American Sign Language, but different forms of sign language, then you have a process already in place. And that also addresses the whole thing around emergency or last minute, because the work that we do is around crisis intervention, y'all, and we get that. So once you have this plan in place and you have vetted the folks that are going to provide that assistance, which we call co-advocacy, co-advocating with interpreters around either sign language interpreters or spoken language interpreters, and you have that expectation of them. Sometimes it's going to be last minute because of the work that we do, and having conversations with those organizations that would provide that assistance to you around co-advocacy, having that understanding. So you start that conversation because, yes, the work that we do is often last minute, survivors are coming in the emergency shelter or whatever. So again, to me, it's just preparing the expectations of those folks you're collaborating with and the different from folks that provide the different forms of services that will contribute and help the communities that we're trying to help with, right? Because again, the success of our advocacy is tied into the collaboration and expectations of those collaborations with other organizations or other service providers out in our communities, whether it's law enforcement, whether it's the prosecutor's office, whether it's community-based health services, whether it's social workers or therapists. You have to start that conversation and setting that expectation for everyone, just like Lumadi said. So to me, it just, as long as you have a plan and you have that expectation and you've had that conversation with your partners around co-advocacy, we're a crisis center. A lot of times it's last minute or it's a moment of crisis. This is the expectation. Who can we count on? Who can we call on? And you have that, and again, you have to, just like you have that conversation internally and those expectations, you have those conversations internally with your organization, you have to have the same expectations with folks you are collaborating with. Because again, the success of our advocacy is directly connected to folks out in the community. Because as amazing as we are in our services that we provide internally in our organizations and our crisis centers, it is limited based on the collaboration and cooperation and buy-in by other folks who are out there that are going to provide that service. Because I cannot, if a survivor comes in and they have injuries, I cannot help them. I am limited by that, so I need the collaboration of someone from who's a doctor or a nurse or whatever to address those physical injuries. So again, putting that perspective to me is always important. And again, regardless of who's answering the call, I mean, we all should be able to pick up that plan, and you may have a little bit of anxiety over it, and that's okay, but it doesn't matter whether you're the receptionist, you're the finance person, or whatever. You should be able, at least at the initial interface, we can start setting up that process and expectation for the folks or for the survivors or the participants that are coming to our organizations. Mari?
Yeah, and I would just add to that, going back to the question that was asked about, as you're developing your language access plan for folks with limited English proficiency, what we've also seen are organizations who are also being inclusive of the deaf or hard of hearing community. So you have a real opportunity here as you're developing your plan to also include in your plan, right, there's going to be a section of your plan where you're going to be indicating the why you're doing this work. And most likely in that section you will highlight the Civil Rights Act, Title IX, and you'll also highlight the Executive Order 13166, but you can also highlight the Americans with Disabilities Act, which is the federal requirement that requires us to provide access to services for individuals with disabilities. And so you'll be able to include that federal requirement in there, and also ensure that throughout your language access plan that you are addressing both the needs of individuals with limited English proficiency as well as those with deaf or hard of hearing community members, individuals, or individuals with disabilities. And just a really quick plug, also Y and I are also working on another language access project through VERA, the VERA Institute. It's called Translating Justice. And the Translating Justice is a curriculum that we've put together. It's a 7-module curriculum that walks you through the development of your language access plan. And it includes some critical pieces around being inclusive of deaf and hard of hearing communities. It includes pieces around working with interpreters, the differences between interpretation and translation. And that curriculum is going to be available free of charge to all victim service organizations. I want to say as of before the end of September, and it'll actually be listed on OVC's, on VERA's website, on OVC's website, and also on Casa de Esperanza's website. So once that information becomes available, we'll make sure to share it with everyone at PCAR, and then they can share it with you because it's another resource that'll help you also make sure that you're connecting those multiple arenas of language to include deaf or hard of hearing community as well, or individuals within the disabilities community. So that'll be another great resource. Going back to the questions here, Jose, I want to answer that first one. I want to go to the second one a little bit. He touched a little bit on that one, and he did mention co-advocacy. And I wanted to talk a little bit more about what co-advocacy looks like in terms of providing culturally and linguistically appropriate services. So something that I had mentioned in one of the webinars around co-advocacy is a component of our Latina advocacy framework and how we provide advocacy to Latina survivors of domestic violence and sexual assault. And so co-advocacy for us is really a framework or a model that allows us to work in partnership with other domestic violence and sexual assault serving organizations in the Twin Cities, in Minneapolis and St. Paul. And basically what that looks like and where it came from, what spurred us kind of taking on this co-advocacy model and doing this work and infusing it within our work, was that we often found that Latina survivors who weren't able to come to our shelter were, of course, placed in other non-culturally specific shelters throughout the cities. And what we've learned from research is that, survivors would prefer to receive services that are both culturally and linguistically relevant to them. And so we started having conversations with some of the non-culturally specific community-based organizations in town about how can we work in partnership to ensure that we're able to provide the best advocacy services for those Latina survivors who might be in their shelters. And so what we do is that by way of a letter of agreement, we've made the commitment along with about 10 other DV serving organizations, DVSA serving organizations in the Twin Cities to provide co-advocacy services. And what that looks like, for example, is when we were in the midst of developing our language access plan at CASA, we actually had a survivor in shelter who was from the Hmong community from Laos, and she spoke Hmong. And so, we're a Latina serving shelter where our advocates are bilingual in Spanish and English. We don't have any advocates who speak the Hmong language. And so for us, we were trying to figure out, well, we could communicate with this individual via the language line. At that time, the only time we were able to use the language line was for crisis intervention and for the intake process. And so what we were able to do with that particular individual was, after using the language line, we had reached out to the local Hmong DV service organization to let them know that we had a survivor in our shelter from the Hmong community, and that we would want to partner up with them to provide advocacy services. And the way that that looked like was that this Hmong advocate would come to the shelter every day to meet with the survivor, making sure she's getting everything she needed, taking care of her, as best as she could, and then working in partnership with Casa de Esperanza staff at shelter so that we were informed of the conversations that were had, so that we can communicate with the individual as well while the advocate was there during those moments. And then what we were able to do as well, since our language access line, we don't have a contract per se directly with the language access line. We access the telephonic interpretation line through Day One, which is a statewide organization that keeps track of all the shelter beds throughout the state. So they know who has what beds available and who's full and all that good stuff. So they're also the provider of the telephonic interpretation line. And we have been contracting them for many years around just accessing their line for crisis intervention and for intakes. And so as we were developing this plan, and given that we had the situation unfolding in our shelter, we reached out to Day One and said, hey, we want to be able to use the language line anytime we need to communicate with the survivor in shelter. And so what that looked like is just like, advocates communicate with any other Spanish-speaking or English-speaking survivor in shelter, we would just use the interpretation line. We would call, walk the phone up to her room, have a conversation to see how she's doing, if there was anything that she needed, if she wanted to come and hang out, with some of the other women, if she wanted to join group that day. And so we kind of expanded how we used our telephonic interpretation services through Day One, and they agreed just to bill us as needed for any of the time that we used. And so co-advocacy really is about informal or formal agreements with other organizations, both non-culturally specific and other culturally specific organizations, to ensure to make this commitment that we will be supportive of each other and will work in partnership with each other when any of us has anyone in shelter who might want to work or receive services that are culturally and linguistically responsive. And so that work is done in kind. There's no exchange of monies or anything like that. It's really done in kind, and it's reciprocal. And what we did is we met with each organization individually, and then we all met together to kind of define what those co-advocacy agreements would look like for all of us, because we all kind of work together to ensure that no matter where an individual or survivor with limited English proficiency is placed in whatever shelter within the cities, that we are willing to partner up with them to provide the best services that we can provide to ensure that that survivor has access to both culturally responsive and linguistically appropriate services. So that's kind of how we do our co-advocacy work at Casa de Esperanza. And it's something that, has been very beneficial, not only to the survivors that we work with, but also beneficial in building and strengthening relationships with other domestic violence and service providers in our service area.
And
then,
if I may add, Lumari, this is Jose Juan. And beyond that, if there is an opportunity to do a collaborative project through grant funding, and you're trying to engage certain communities that otherwise you can't, and you need a certain expertise or knowledge around culturally specific communities, and you develop these co-advocacy relationships, the equitable thing to do is to allow that culturally specific organization perhaps be the lead on that project, and you still support them, because I think it's also about fair compensation, because as we've kind of mentioned before, just like internally, like Lumari said, you determine compensation for a skill set around someone who is a bilingual advocate, but the expectation is for these other things to happen. And you have to also be mindful of that when you're co-advocating with other partners in your community, to be also compensating them for their time in an equitable way. Because so often we see non-culturally specific organizations take the lead and say they're providing these services to various specific and culturally specific communities, but they lack the biculturalness or the bilingualness or whatever of engaging, and then so they engage culture-specific organizations, but they don't compensate equitably for their expertise. So in addition to that conversation around co-advocacy, if the opportunity arises, if there's an RFP for a specific grant around, let's say, engaging Latina survivors, but your organization does not or lacks the content expertise, and you're wanting to co-advocate with another organization, please let them be the lead, and please be fair and compensating and equitable in those relationships. Because if we don't have the expertise, then let others do it.
Thank you for that. Thanks for sharing that. It's awesome. And I think we have one more question. What forms of cross-training for interpreters and translators do you all recommend? Well, personally, I recommend all the training. And so, and I'll refer back to like when I was in the process of vetting interpreter services. I actually just went online and did a search and came up with like 10 different organizations. And one by one, I set up calls just to kind of get a feel for them as an organization, to get a feel and understanding for how they typically provide services. And then I took some opportunities to share with them who we were as an organization, what kind of services we provide, the sense of urgency that we would need interpreters with, right? So some organizations would say, well, we could probably get someone out to you 48 to 72 hours. And I'm thinking, no, minimum 24, maximum 24. And so I kind of went through a list of questions that I kind of came up with myself to kind of figure out how to vet some of these interpretation services. But something that I did do as well is in these conversations with them as I was vetting them, I made it very clear that in order for us to be able to contract with them as a service provider, that part of our requirements would include providing training to their staff, and that we would provide training to staff, so to the interpreters and any translators. We would provide training to them on domestic violence and sexual assault, possibly some human trafficking, if you're seeing some of that in your area. We also would provide training on secondary trauma, right, vicarious trauma, really looking at what that is and what it could potentially look like. Having conversations and providing training on self-care for interpreters and translators, simply because a lot of them are just not familiar with the experiences of victims of domestic violence and sexual assault. For many interpreters, they're going to be hearing these stories for the very first time, and we all know that it's very difficult to separate yourself from what is being told to you. So I think, in our due diligence to not cause any harm to anyone, we want to make sure that when we're talking to these interpreter services, that we're being very mindful and intentional in offering capacity building opportunities for their staff. So we'll want to look at, doing a training, like I said, on DV and SA, looking at, what vicarious trauma is, looking at what triggers are, right, and how one can be triggered by information. Because the reality is that we don't know what the lived realities or experiences of these interpreters are, right? For all we know, that might be a childhood witness of domestic violence, or they might be a survivor of sexual assault, or they might be living in a domestic violence situation. We just don't know. And so we want to be very intentional and mindful to ensure that any interactions prior to any interactions that the interpreters might have with our clients, that we've done our due diligence as much as we can to prepare those interpreters for what they may encounter, right? And so that also includes providing some training on confidentiality. I know a challenge that I had in Minneapolis was that there was a large Somali and Karen community. We're an emergent Karen community and a large Somali community, but very little interpreters. I think there were like 2 interpreters for the Karen community. And since the community was an emergent community and it was a rather small community at the time, you know, many folks in the community knew who those interpreters were. And those interpreters were, you know, familiar with some of them, a lot of the members in that community. So even thinking about, you know, how do you prepare an interpreter to ensure that they're able to provide their service and maintain their level of confidentiality so that they don't go back to their community and say to so-and-so, oh my gosh, you know, she came by to get these services, I provided the interpretation services, and kind of this is what happened, right? Or also being very aware of or providing trainings to interpreters around domestic violence is critical because it helps interpreters, especially if they're interpreters from foreign countries, really understand the dynamics of domestic violence, because oftentimes when we come from foreign countries, even though domestic violence does exist, it may not have a name, right? And we want to make sure that folks are familiar and really understand what domestic violence and sexual assault mean, right? We want them to be familiar with the terminology. We want to be able to ensure that we're able to clearly communicate what that terminology means. I know I have a colleague who works for API GBV out in Oakland, and she talks about a training that she had been doing for interpreters. I want to somewhere on the West Coast, and it was she was dealing with an interpreter who spoke Russian, and this Russian interpreter was actually interpreting for a survivor of sexual assault. And and as the woman was describing her sexual assault, the Russian interpreter would not use the same vocabulary that the victim was using, right? Because he, for example, refused to use the proper name for the male anatomy, the male anatomy, I'm sorry. And so he wouldn't use that language, he wouldn't use that terminology because he said it was vulgar, right? Or using the proper name for female genitalia, he also wouldn't use that terminology. So it really is our responsibility to do our due diligence to ensure that the interpretation services that we're working with kind of really understand the work that we do, really understand the level of crisis and how critical the work is, and really have a good foundation of the terminology and the concepts of domestic violence, sexual assault, and human trafficking. Because a lot of them don't have access to those capacity building opportunities ever. And so when I was vetting interpretation services, for those that I had conversations with, I would say 3 out of the 10 that I actually spoke to, only 3 were in agreement to allow us to present any type of training to their staff. And so for me, the fact that they were willing to do that set the message to me that those were organizations that we wanted to work with. For the other 7, it was very clear that they had no interest at all. They did not see the value. And I think for us, knowing that, you know, again, we don't want to cause any additional harm to anyone or do no harm to anyone, it was critical and important for us to be able to work with organizations who valued what we were offering as much as we valued what they were offering. So I would say, you know, really think about what types of trainings you feel are going to benefit interpreters in providing the best services possible for the service area that you're serving. I know that the challenge here is with interpreting the telephonic interpretation lines. Well, those folks just are not interested in any type of training that we want to receive, and that's okay. I mean, it's understandable. Because, you know, we can't force them. We can't force them to do that. But, you know, at least being able to bring it up when you're talking to individuals on securing a contract or having conversations about what that contract is going to look like, it doesn't hurt to ask, but just be prepared to know that those lines yourself, like interpretation lines, just don't have or aren't at that place, or maybe the conversations that we're having aren't with the correct people to have those conversations with. I think we would have to go at a much higher level to see what we can do to ensure that those interpreters on those phone lines get some of this training as well. But at least with the local interpretation services, you have a bit more leeway and a bit more opportunity to actually influence them and provide some of the capacity training opportunities.
Thank you so much for a great answer to that question and to all of the questions. We are just a few minutes over time, so I wanted to just kind of end in closing, but say thank you so much to Lumari and Jose Juan for their great insight and knowledge that you've shared with all of us today. And if anyone has any questions that we didn't get to answer today, like, please feel free to reach out to anyone from PCAR. We can get you in touch with Lumari and Jose Juan, or you can contact them at Casa de Esperanza. So thank you all again for participating in our web series about how to develop an effective language access plan.
Thank you. Have a great afternoon.
Thanks, you too.
Take care.